Hi, we're here to show you the top 3 exercises for lower back pain during pregnancy. My wife Erin here is going to be our model. She just had a lovely 9-month-old, 9 months ago, our first son, and she can attest to having low back pain during pregnancy. And I'm going to show you, for us as physical therapists, what the most common solutions to that pain is. The first thing we're going to do here is we're going to stretch out the muscle group in the front of the hips that attaches to the spine, called the hip flexor or the iliopsoas, and we're going to do that in 3 planes of motion. This gets limited in motion due to sitting, and also it's part of the reason why the back arches when you're pregnant, the weight, and then that causes a big arch. So Erin has 1 foot up on a bench. Go ahead and take a little step back. Yep, good job. And then ideally holding on to something, but her balance is pretty good. She's going to simply drive the pelvis forward. What we're going to watch for here is we're going to watch for this lower back. We don't want to have that curve. In fact, what we're going to have Erin do is come back here. We're going to tilt the pelvis back a little bit to flatten the spine out. Then she's going to simply drive the hips forward and back. This bottom foot is going to be nice and straight. In fact, we're going to turn it in slightly just so we don't lose that stretch. So she's going to spend 30 seconds going front to back. Should feel a nice, why don't you show them where you feel that? Right in the front of the hip is exactly where we should feel that. After 30 seconds, then Erin's going to take the hips and go side to side. Yep, you can tell it's a little tight. Good. And then the third and final motion here is going to be hips going around in circles. And in this case, we're going to choose a counterclockwise circle. Again, 30 seconds, keeping this knee nice and straight. And we're going to try this on both sides, okay? So there's our number 1 movement that we're going to find the most success in treating the SI or lower back pain during pregnancy. Okay, the second area that we want to work on is, now that that hip is nice and loose, we want to provide some stability for that area. So let's come on out here, we'll face these guys, and you're going to simply stand on your left foot. You're going to take your right foot and toe touch in front of you. You have a little balance challenge here, and you're going to take your hands, hold that there, you're going to take your hands and go forward and back 10 times. Good. So now we're asking that muscle area to not only stretch, but also to control the motion. Otherwise she'd be falling over. Good job. Okay, after her 10, then we're going to keep that position, hands go up, and we're going to try side to side. Good job. Good job. After her 10 there, we're going to take the hands and rotate left and right. Good job. Now, if that was hurting her lower back when she was doing that, simply move the hips front to back, side to side, rotate left and right instead of the hands. So that's the second movement or exercise that we're going to do to create less lower back pain. And the third and final area that gets limited in motion because of being pregnant is this upper spine, this thoracic spine. And so what we're going to do is we're going to use our arms in order to stretch out that thoracic spine. So I'm going to have you actually sit down. So we're going to do this in a sitting position so that we don't have as much hip contribution. So the first thing I want you to do, Erin, is you're going to take your hands and do a reach, a big reach forward and back. We would prescribe this as a 20 repetition movement. Now take the hands and go straight back overhead. Good, 20 of those, 10 each arm. Now I want you to try going side to side. Good. Now you're going to rotate across the body. 20 of those, and then finally reach behind. Good job. And what that's going to do is loosen up that thoracic spine and provide less compression in the lower back. And those are our top 3 solutions for lower back pain during pregnancy. Thanks, Erin.